For more than 40 years, the Parkinson's Disease Society has been working hard to improve the life of people living with Parkinson's. Over that time, we've invested over £45 million in research, we've put in place 280 specialist nurses, and we've provided information, friendship and support to hundreds of thousands of people. But there's still more that we need to do to reach out to everybody that needs us. We've been listening carefully to the people that we work with and who need our support. That's helped us to identify a very clear vision, and that is to find a cure and to improve life for everyone affected by Parkinson's. We still have a lot to do and achieve, and we can't do it alone. We need to harness the knowledge, the skills, enthusiasm of everyone involved in the work of Parkinson's UK, wherever they live. Only by working together can we make our vision a reality.
We'll reach out to everyone living with Parkinson's to make sure they all know about us and the support we offer.
I didn't know anything about it. Wasn't expecting it. It was a total shock. And it's a scar that I've still got. I asked if they had any information. They couldn't find any. There were no leaflets, no nothing, no support, and no nurse with any specialist knowledge, and I was just left.
So if we're really going to make sure that nobody has to face Parkinson's alone, we have to make sure that we understand the needs of the whole Parkinson's community, where they are, who they are and what their needs are. So we're doing more research in that area. But we're also making sure that we're monitoring the uptake of our services, looking at where the underrepresented groups are and targeting our promotion towards those groups.
But I know that the experience of being part of a group, people get so much support from that and knowledge that they're not on their own with Parkinson's, that we are a community who support each other and prop each other up in the bad times.
The experiences of people living with Parkinson's must be at the heart of everything we do.
We're making sure that our resources are relevant and appropriate for people with Parkinson's by involving them in every stage of the development of all our materials. We do this in a range of ways. For example, we might get feedback on a booklet, or we might hold a focus group, or we might go along to a branch and talk to people there. This means that we can be really confident that the resources that we produce meet the needs of people affected by Parkinson's wherever they are on their journey.
I think one of the things that really marks Parkinson's out is the steps it has taken to involve patients and carers and the public much more in terms of taking those funding decisions. When you look across the sector, there are many membership organisations, there are many charities that have a large volunteer group. But I think one of the really exciting areas inside is how you bring that huge body of people to bear on your research and help to identify the research questions that really matter to them, help you to fund the right things, help you to evaluate whether it's been worth funding in the future, and then help you get it out there as ambassadors of the charity. And I think Parkinson's UK, along with a few others, are really, I think, showing the way about how to do that. And I think it's something that you and your volunteers and supporters should be very, very proud of.
Everyone affected by Parkinson's should be able to access health and social care that meets national quality standards.
Having a Parkinson's nurse is an absolute godsend, because my GP is a really nice guy, but he doesn't know that much about Parkinson's, and I only get to see the consultant once in 6 or 8 months or something like that, whereas knowing I can contact my Parkinson's nurse anytime, day or night, anywhere in the world, she'll get me on email. It just makes me feel free to live my life as I want to live it, knowing that I've got that backup, that support.
Because we believe these services are so important, we actually take on a role of campaigning at a national and policy level to ensure that the messages from the local services get turned into national policy and guidelines.
Whilst we have trained thousands of health and social care professionals, there are still many more treating people with Parkinson's who have a limited knowledge of their condition. We know that the training that's provided by Parkinson's UK has made a difference. We've been contacted by several GPs who have told us how the training has improved the care that they can provide for people with Parkinson's, through understanding the complexity of Parkinson's and through understanding the importance of medicines management.
Our ultimate ambition is to find a cure so that people can live free from the symptoms of Parkinson's.
This is a really exciting time for Parkinson's research. There's a lot of major breakthroughs which have come through in the recent number of years. A lot of these, in fact, funded by Parkinson's UK. We're at a stage where I can feel that there is a cure just around the corner, and it's very important that Parkinson's UK, working with other organisations, continue to fund the highest quality research so that we can make a cure for Parkinson's a reality.
Having this 5 years funding from Parkinson's UK, the Monument Trust Discovery Award, is really important for us because it gives us a long-term programme of research. The group of us here in Oxford have worked together before on shorter-term projects, and we're delighted to be able to have this long-term, secure funding to be able to develop a platform of work, a programme of work over the 5 years. The Parkinson's UK is the biggest funder of Parkinson's disease in the country, and the funding they provide is absolutely essential for the work that we do. Without it, we simply couldn't do the work, and without the work, without the research, there won't be a cure.
A total cure is fairly important. I wish to see my grandchildren grow up. And that's the main thing. That's a fairly important thing in my life.
To achieve our ambitions, we must raise more than £110 million by 2015.
In terms of the £110 million target, I think there are three core elements in terms of how we're going to get there. The first one is making sure that we're developing and maintaining the loyal supporters that we already have and we've had for some considerable time. The second part is inspiring new supporters and bringing new people in to support our work. The third part, and in many ways it's the icing on the cake, I think, is making sure that we're telling people at every possible occasion the importance of the work that we're doing. And what I mean by that is it's not just about telling people about what we plan to do. It's about telling people what we've done and the successes that we've had. And also sometimes telling people about the challenges that we're facing. And by doing that, inspiring them about the vitally important work that we're doing. Because the fact is, if we're not doing it, there's nobody else doing it in the UK. And therefore there's nobody else supporting people with Parkinson's. And that's the challenge for fundraising, and that's why the £110 million as our starting point is so important.
We like to choose a national charity that operates throughout the UK, so the charity impacts and supports people in areas local to our staff and our customers. We want to help raise funds to support people with Parkinson's and also assist in the search to find a cure. We also want to give our staff the opportunity to take part in events and activities and have some fun. Finally, we want to work with Parkinson's UK to generate PR stories, to raise awareness about Parkinson's and also about the work that you do.
My mum has Parkinson's disease, and I could see the good work that Parkinson's were doing for my mum and supporting her, and it was my way of helping. You know, I live 300 miles away from her and I can't support her on a daily basis, so you know I was very happy to go on a trek, which I did last year, which I thoroughly enjoyed, and my children have done a coffee morning as well, and to raise some money. And also it's increased awareness with my friends who knew nothing about Parkinson's before I started fundraising, and they've all taken an interest, and I know they'd be more than happy to help me again when I next do another event or another trek.
Our vision, values and goals will keep us on track and make sure we all share a common purpose.
It's important that we have a shared vision to make us a stronger organisation moving forward with our new strategy and plans. If we all work together to make our values a reality, we can become so much more focused and effective. We can find a cure and we will improve life for everyone affected by Parkinson's.
Because Parkinson's disease doesn't just affect people in their old age, in their 70s, you have a lot of young members.
I'm really excited about Parkinson's UK and the way we're moving forward. There's been a lot of changes, and I'm sure there'll be many more changes in the future, but it's really inspiring and very positive, and hopefully we're looking for that cure.
I've been a trustee of Parkinson's UK for 2 years, and I've worked in health charities, much like this one, as an employee and as a trustee for the past 18 years. 3 years ago, my husband was given a diagnosis of Parkinson's, and my personal and professional lives collided in a dramatic and unlooked-for way. We turned to Parkinson's UK for advice and support, but it was only because of my work that I knew that we could do that. Not because any neurologist, GP, nurse or any other health professional had told us about it. And it was partly out of a wish to help others enjoy the kind of support that we had found that I joined the Board of Trustees in 2007. In all my previous charity roles, I've recognised and articulated to others the need for us to work ourselves out of a job to make the charity no longer necessary. That must surely be the ultimate aim of any charity whose goal involves the alleviation of distress. But in all those other jobs, I've been there primarily out of a wish to support the cause and serve the beneficiaries of the charity. Now it's different. My husband has Parkinson's. So when I speak of the need for the charity to become unnecessary, I mean it with a quite different intensity. I want there not to have to be a charity funding research into Parkinson's and improving life for everyone with Parkinson's. I can't believe that there is anyone out there in any of our branches who doesn't want that too. The paradox is that it's this desire not to have to exist that brings us together in this great charity.